My name is Erika Spring. I'm a registered dental hygienist and the owner and founder of Spring Innovative. Today I'm going to be talking to you and address the dental exam. But before we get there, I want you all to know that the assessment begins at hello. As dental hygienists, we have a great ability to impact the patient's oral health and systemic health by utilizing simple techniques to determine risk factors. From the moment you walk your patient back to the operatory, it begins with hello. We meet and greet them and we can determine their cognitivity, their dexterity, and much, much more. From there, we have the medical history forms in our hands. For years, dentistry has been focusing on oral health limited to the mouth. Yes, we know that periodontal disease and diabetes has been linked together for many, many years, and even heart disease. But what we're finding now is the inflammatory burden on the body put forth by untreated gingivitis and untreated periodontal disease is causing more inflammatory burden than the patients can handle, especially if they have an autoimmune disorder, rheumatoid arthritis, fibromyalgia, and we're now even seeing critical links to pancreatic cancer and more. Have you ever thought about this with your patients? We have the ability to identify risk factors in the patient's medical history that can truly impact what the outcome is. What are some of the things that you do in your practice? Have you been able to identify inflammation and inflammatory systemic diseases? Today I want to talk just about two things: the inflammatory burden and communication. We know without the inflammatory process, wounds wouldn't heal. Well, our mouth and our oral cavity can be a wound if it's not taken care of. It can be wounded and it is producing inflammation that is affecting the rest of the body. Where the inflammation process is truly going to be impacted with what we know as bleeding. When we can address the bleeding, we can also address how to control the environment in the mouth. One of the things we know about inflammation is it's part of the body's immune response. So, how do we know where oral health fits in? We are all superstar professionals that know that we can attack the plaque by creating an environment where biofilm is diminished. Why not put something right in the palm of the patient's hand that can directly impact their overall oral health? Studies show that brushing with a power toothbrush is typically superior than brushing with a manual brush alone. And that can affect the patient's inflammatory process directly. And that's right, the burst brush is just one of those things. Patients come to the dental hygienist twice a year. In fact, they spend more time with us in our chair, 2 hours a year, or sometimes 4 or 5 hours a year, and that's typically more than they see their medical provider or their dentist. One of the things I love about dental hygiene is our ability to not only treat the patient and impact oral disease, but to truly impact the patient themselves. Patients have no idea that the mouth is connected to the rest of the body, and that's why I love being able to determine in the dental exam and through the medical history what factors we can truly implement for the patient's home care and things that we can refer. In other words, it's great to be able to perform oral airway screenings to determine sleep apnea. It's great to have risk assessments to determine blood glucose levels. And I think it's even important to have a referral source for your patients through the dental exam to be able to have a medical provider or provide medical treatment so that they may be screened for other types of systemic and oral diseases. So as hygienists, we have the ability to truly impact the patient in many levels. Thank you, and thanks for watching.